So, Alex, before we get into the characterization of this Affordable Health American Health Care Act, let's just call it Republicare. Before we get into this Republican care, characterizing it, because I know you have some. I know that you are still searching for words to express your shock at how bad this bill is. Just give us the broad outlines of what this healthcare proposal does.
First off, I call it Trump care because Kellyanne went on television and said that he hates it being called Trump care. So, I think there's a lot of opportunities for portmanteaus here, but Trump care is what I'm going with. And
sure.
It really is. I mean, at its very basic, the very basic take on it is just worse Obamacare. It's literally Obamacare just made worse. And it does not get rid of the underlying structures of Obamacare. It actually maintains those. It just makes them worse. It's like everyone was like, I hate Obamacare because premiums are going up. And the Republicans were like, oh, okay, well, we'll make the premiums go up more, plus deductibles will go up, and you'll get less insurance. Are you old? Then it's going to double, triple, quadruple, probably $8,000 more in premiums is what you're looking at. I mean, it's really astoundingly terrible. And, I'm kind of joking about it, but the sad reality is that if it actually passes, it's devastating. I mean, literally devastating. It cuts $370 billion out of Medicaid. It just decimates Medicaid, basically destroys Medicaid. Medicaid provides health care to millions of children, people with disabilities, and is the largest provider of long-term care in America. That's nursing homes.
That's something that people I don't want to let that slide by. What most people don't realize is that I think more than the majority of people on Medicaid at any given time represents elderly people who have basically spent down their life savings. They have no more money. They are living in a nursing care. They have gone from Medicare to Medicaid, and they're living in some type of facility. It's Medicaid that is paying for this. I don't know that people fully realize just how big of a role Medicaid plays in the lives of our very elderly in this country.
And I agree completely. I would just put a few extra things on there. Nursing homes plus in-home care.
Right.
But long-term care for seniors, there is no system in this country except for Medicare, which takes up somewhere around, Medicaid, somewhere around 60 to 70% of long-term care is paid for by Medicaid. Now, the reason that it gets a little fuzzy, but this is why it's so important to understand, is in that 60 to 70, you have about 9 million seniors. In that 60 to 70%, that encompasses the total number, 9 million, who are called dual eligibles. So they receive both Medicare and Medicaid, depending on which service they are actually taking at that point. It's like really complicated logistical billing stuff because we don't have a rational healthcare system in this country. But these are two parts that actually do work. And if you get rid of Medicaid, which is what the Trump care bill does, it just destroys it. It destroys Medicaid. You also, through the dual eligibles, you massively impact Medicare, and Medicare starts coming down, which is what they're going for. It sets it up so that Medicare can't actually continue. They cut out $326 billion in funding directly from Medicare, plus they blow a hole in it through destroying Medicaid, and that tees them up for exactly what they want to do, which Tom Price, Paul Ryan, and the others have said, which is go after Medicare in the first 8 months of this year. So that's what you're seeing here, is actually teeing that up perfectly by first destroying Medicaid, which too many people don't fully know what Medicaid does. And so, they feel like they can get away with destroying Medicaid. I'm looking at this bill, and I am not sure the politics of it work. We're going to do everything we can.
Before we get there, because I think to a certain extent, at the very least, you've touched on a rationale for this bill that I hadn't contemplated. And I want to put a pin in that, because I want to just make it clear to people what's in this and why there is such universal condemnation of this bill. And I mean really universal, to the point where sometimes I feel uncomfortable with, the people who are against this. But so just to be clear.
Like Heritage Action is who you're saying, right? Heritage Action was like the first out of the gate condemning it.
And also, not only on the far right do we see problems with this, but someone like Avik Roy, who was always considered the reasonable conservative response to the Affordable Care Act, he came out with a piece that basically said, this is a great bill, except for it makes health insurance unaffordable for millions. But before we get there, there are three parts to the Affordable Care Act, broadly speaking. There's the expansion of Medicaid. There is the making basically what I would call a patient's bill of rights, which ensures that the health insurance you're getting is actually health insurance. It's not a car you're buying that has no brakes or has no engine, for that matter. And lastly, it provides subsidies in these individual marketplaces and allows people to afford health insurance, and in some ways redistributes it. Doesn't make it affordable for everybody, and it doesn't make it genuinely affordable. It just makes it within reach. And those three elements are all in different respects under assault in this bill.